The Stephen Handysides show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.
Welcome to the Stephen Handysides Ultimate Beauty Show. Step inside my Ultimate Beauty Clinic and discover a world where the very best aesthetic, beauty and fitness experts will be demonstrating to you just what can be achieved. Whether you want to look younger, change your image, get fitter or sleep better. Now coming up, we'll find out more about surgical and non-surgical facelifts, how lasers can create remarkable rejuvenating results, and meet our experts that know everything there is to know about breasts. We've also got this season's hottest red carpet look, and our experts will show you how to do this at home. Let's take a look. We're here in the cosmetic clinic and we've got some fantastic cosmetic doctors and some exciting treatments we're going to be showing you, hence all the noise in the studio. Now first up, we're here with Dr. Prima. This looks very, very interesting. What's going on here?
This is the Vanquish machine, and it is a radiofrequency device which actually targets the fat cells. The fat cells are then in turn filtered into the lymphatic drainage system and metabolized by the liver and then excreted by the urine.
Dr. Prima, the other machines that I've seen, and I've actually tried a number of them, this does not touch the skin. The other ones seem to touch the skin. What's the difference and how much more effective would that be?
Exactly. So this is the only machine that it's contactless. It doesn't touch the skin at all, and it still manages to target the fat cells, but without affecting the skin or the muscle at all.
And you were saying it's actually more effective, that the radio frequency is picking up where the fat cells really are rather than moving it around?
Absolutely. There are sensors built into the device which actually customizes it works out how much energy is needed in which area.
So somebody's really going to see results, like they get smaller?
From the photos that we have seen, we've had significant results, but it does take 4 to 6 treatments, and it's weekly.
Great. I mean, I think, you know, radio frequency, I mean, this is a new technology, isn't it? Radio frequency's been around for a while.
Absolutely.
But look,
I've never seen this.
I think it looks very, very intriguing. Now, for all you viewers at home, as Dr. Prima said, you're looking at about 4 to 6 treatments, £500 per treatment session. Also, other types of technologies that are out there are things like cool sculpting, lipo light, but this is fantastic. So thank you very much for showing us that.
Pleasure.
Okay. Next.
Let's go over to Dr. Fab from Liverpool. Now, you're doing an anti-aging treatment, would you say?
That's right, Stephen. Once we all get beyond our mid-30s, what happens is the eye socket opens out and downwards. We lose some bone off our cheekbones, we lose some mid-face fat, which will, in some people, cause jowl formation, drooping of the tissues. In Simon's case, it manifests itself as when he smiles, although he's had Botox around here, you can still see these zygomatic lines, and that's the action of this muscle, zygomaticus major, which makes you smile against the volume loss. If I go nuts with Botox here, we're going to give him a wonky smile, but by replacing lost volume, we're going to disguise the appearance of those lines and also lift the tissues a bit.
So does the lifting effect actually create a volume appearance? It'll actually
It does. I mean, one of the characteristics of a youthful face is volume, nice curves.
Dr. Fab, let's see the results, because you've treated one side of the face already.
Sit Simon up. So I've just treated the left side of Simon's face, and what we can see if we look at him straight on is that the cheekbone on the left is higher, we have more volume, it looks better under the eye, but smile, we can see less zygomatic lines on this side than this side.
So in terms of the results, do people need to come in for a top-up treatment at all?
Yes, I mean the results, as you can see, are instant, but sometimes it can be and then some, because fillers can cause swelling. The injection technique with the candy can cause a bit of swelling, so I always review them 2 weeks later to make sure that the result is right. I usually give them a bit of a top-up.
And how long will it last?
We should get a year out of this, but
Oh,
sometimes longer, because when you stretch tissues, it can stimulate fibroblasts to produce collagen, so don't be surprised if you get more than a year out of it.
So if you keep getting them in, will it build up over time enough that you wouldn't need it?
Yes. You'll find that with repeated treatments, you'll need smaller volumes, and the intervals between treatments will extend.
So yeah.
Dr. Feb, do you want to just do some injections for us before we move on? And I'll ask Simon how it feels.
It looks, you can really see. I mean, you look like you have a high cheekbone now.
That's good.
That's very exciting.
To ensure Simon's safety in this procedure, I'll be injecting not with a needle, but with a cannula, which is blunt. So I need to make a nick in the skin with a normal needle, just to get it through. And that's our cannula.
Wow. Ooh. So laboratory looking.
And the advantage of this is because it's blunt.
Go right back in that same hole.
Because it's blunt.
Wow.
No bruising. It's not cutting anything, and also there's no danger of being inside a blood vessel. You accidentally inject filler into a blood vessel, it can be catastrophic.
Does it hurt, Simon?
No, it's a funny feeling, but it doesn't hurt.
Okay.
So I'm now just fanning this filler. See, through that one entry point, I can reach around a lot of the face.
You're sitting on top of the muscle?
With under the skin,
Under the skin.
subdermal. And then once I've done this, I'm going to be coming into the cheek, and using the cannula, we're going to put some filler in the mid-face, which will help under the eye, and then I'm going to reach up to here, and then just put a bit more volume over
So it's
his
almost like
cheekbone.
threading it in different angles.
Right,
to
we're
pull
going to
it
let
up.
you
Wow.
carry on here, Dr.
Fun.
Feb. We're going to move on to Lauren from Juvia
Love it.
Aesthetics.
Okay, we'll be
Now,
back.
So Lauren, this is where all the racket's coming from.
Yep.
So you've got obviously a little gift for everyone in the studio.
Yep. If you
Why-
can,
what are these?
laser protection goggles. When we're using laser, we just need to make sure that we're protecting our eyes.
Great. All right, everyone in the studio, including camera people, glasses on.
Okay. Little space age.
So this is Revlite technology, and what
Yep.
indication are you treating?
So what we'll be treating is pigmentation. Various different types of pigmentation. We've got slight epidermal pigmentation and some PIH as well from acne breakouts.
They always look so relaxing.
I
these
know they
treatments.
look relaxing, but will we actually see a result, or is it something that accumulates?
Yeah, you will need a course, roughly about 4 to 6 treatments. One treatment every 2 to 4 weeks, depending on how severe the pigmentation is.
Does it come back, or is it gone? Once it's gone, it's
Yeah,
gone.
once it's gone, it's gone. But you may need maintenance, and it's important to keep the skin nice and protected and using good skincare.
Well, I can't wait. Let's see it in action. This is like something out of a Star Wars movie. This is
I'm
great.
glad I'm free. So it's safe. We have these glasses on, and there's no
Yeah, absolutely.
no problem.
Yep. Okay, you ready?
Does it hurt, or is it just a stunner?
She'll feel a slight tingling.
It's more the stun. I see a little.
That's just hair vaporizing there. That's
Okay,
that's not going to cause any problems at all.
This disappears.
Yeah, it will do, absolutely. The more we go of the area to warm the tissue up, we get the circulation flowing, boost that collagen and elastin, then yeah, absolutely, this PIH is going to go. What we'll start to see first is we'll get some erythema, and then over a couple of days, it will just start to break down. So
Does
even
the
from one
laser
treatment-
actually know where to target by
Yeah,
the pigment?
absolutely, yeah, definitely. So it uses a Q-switch technology, which is attracted to the melanin, and it shatters the pigment without damaging the surrounding tissue.
This
what-
is quite a popular sort
Yeah,
of
it
treatment
sure
for this
is.
type of condition.
Yeah, absolutely, especially in Asian skin types, people who have deeper dermal melasma, yeah, various different sun damage, but it's also great for acne, general skin rejuvenation, tightening up the pores.
It's okay for all skin types.
Absolutely, yeah, no,
Yep,
all
no
skin
chances of burning.
types, no, very safe laser.
And would you do this, say you had spots on your hands or any place on
Yeah,
your body, or
absolutely,
people
yeah.
have overexposure on their
neck,
chest?
Decolletage, hands, very popular for, definitely.
Great,
Very
thank you so
exciting.
much, Lauren. That's
You
really
look
exciting.
amazing in
So-
just one treatment.
Later on in the show, Danielle will be talking to Dr. Khan, who will be looking at an alternative to alternative solution to pigmentation. I'm here with Dr. Beth Bryden, Professor of Dermatology, and we're going to be looking at the aging process and some of the solutions for this. Welcome to the show.
Thank you, Stephen.
Now we're just going to firstly have a look at an animation here we've got of the aging process. So what makes us age?
Anywhere between 70–90% of aging is actually due to accumulation of sun exposure and ultraviolet damage that we have through our lifetime. Only 10% is due to the natural intrinsic aging. So in this depiction here, you can see the blue ultraviolet rays damaging the epidermis where they cause pigmentation to form. We get a tan and age spots. It actually penetrates deeper into the dermis where it can damage the collagen and the elastic fibers. So we get an overall thinning of the epidermis and the dermal layers, causing our skin to atrophy, showing up as wrinkles, age spots, and that sallowness.
Which we all don't like, the wrinkles. So you're going to tell us a solution to this. So what's a good treatment?
Well, one of the best ways you can do is to use sunscreens to prevent ultraviolet, but chemical peels are one of the most effective ways as reversing some of the early signs of aging, such as the fine lines and wrinkles, the pigmentation, evening out the skin tone, and actually improving our skin barrier to protect from additional ultraviolet.
And this is a patient that's had photo damage, is that correct? And they've had a series of skin peels?
Correct. You can see here the fine lines and wrinkles on the before, and after several skin peels, you can see that the fine lines and wrinkles are diminished, the pigmentation is lighter, and the overall skin tone and glow is much healthier.
Great. And then I've got one other case study here, which is teenage acne.
Oh, the peels are great for teenage acne and even acne rosacea patients. Here you can see the post-inflammatory pigmentation and the active acne papules. And here, after a series of peels, it helps promote clearing of the acne, and it diminishes the post-inflammatory pigmentation.
You can really see a massive difference. And these are using like the Neostrata products that have got, what is the main active ingredient?
Okay, in the Neostrata products, it's a glycolic acid, and it's the most consistent free acid, so it's the most bioavailable peel that there is available.
Great, thank you so much for that. The case studies are absolutely amazing. And if you want to find out any more information about skin peels, the aging process, then go on to myfacemybody.com.
Hi, I'm Danielle Lynn, and I'm here with Mr. David Crawford, and he is a consultant and reconstructive surgeon in cosmetic and plastic surgery from BMI Healthcare. And we were talking, before we went on the air about two really serious kind of issues that face humanity.
Well, I think if you think visually about the differences between male and female and what personifies their body image is for ladies and men for the presence and absence of facial hair and the presence and absence of breasts. And that's why you can understand on both sides, male and female, while the absence and presence of breasts have two very emotional issues.
So when we start to talk about breast reconstruction, for most people, you can't understand why you would do a breast reduction. So why do people do them? Why do women do them?
Oh, ladies with true macromastia, that is where their breasts are disproportionately large in proportion to their frame. It's the bane of many ladies' life. They cause both physical and psychological symptoms. The sort of physical things they tell me, the weight on the shoulders, the rash underneath the breasts, the difficulties they find with clothing. They end up wearing blouses and jackets which are 3 or 4 sizes different. So hiding their breasts.
Uncomfortable. And now you said also that men, that we see and we think that this is new for men to have breast reduction, but that it's actually been a hidden subject for most men for more years than we can imagine.
It's been almost a taboo that many men have suffered with the presence of disproportionate large breasts, which cause a lot of emotional hurt for them, having to wear baggy clothing even in summer, afraid to go to the swimming pool with their children, hiding on the beach on holiday.
And it's a safe surgery all the way around?
Well, all surgery has risks, but if we take into consideration the balance of risk and reward for these patients who have these issues, the risk is reasonable for them.
Thanks so much. And if you want more information, you can go to myfacemybody.com. I'm Danielle Lynn, and we are here at the Beauty Boutique, and we are here talking today about what's hot on the red carpet, and we are here with Natalie Love from the Edward James London Salon, and Nadera, who is an international makeup artist working with Glow Minerals, and I am so excited to hear what's hot. What do you got?
Well, today we're going to do some braids on Alyssa's hair. Braids are fantastic because they're fun, they're playful, they're cute, but they're also quite sexy. They have a bit of a sassy feel to them as well. They're everywhere, and there's so many different ways that you can wear braids as well too. So it's not, you know, just about being a milkmaid. You know, it's not that look. It's really got quite, we want to put a bit more of a punchy modern edge on it.
Yeah, that's going to be interesting because it, you know, it's not an easy look to wear, but I think when you're talking about the way you do it, you seem to have this special flair about it, so it's going to be fun to see how it turns out.
Absolutely.
And Nadera, what are you going to do?
I'm going to concentrate on lips. We're going to get a real splash of bold colour on there, and then a bit of definition around the eyes. Little fill in with the eyebrows, but then concentrate on a healthy glow with a bit of contouring.
How do you do that?
Using your foundation to contour, so using 2 shades, and then also stepping it up with bronzer as well, and a highlighter.
Yeah, I'm excited. I love what you said, that when the celebrity's crossing that red carpet, that you're picking one thing. And I never really thought about that was the impact, but you want that impact look, and I think with your beautiful face and those lips, I think we're going to see something incredible. So how about if I'll step out, you'll finish it, and then I'll come back. Would that be great? Okay, I'll be back. Well, we're back to take the final look at the next Hollywood starlet. You look great. How do you feel?
Gorgeous.
It's dramatic, isn't it?
It is.
See, that's Nadera. She's got that lip thing going. Really, really special, and you nailed it. Exactly what you said.
Yeah, and you know, a good tip for people at home, start with the lips, especially if you're not used to wearing bright colours. Start with that colour. You could always line the whole of the lips with something nude, so it takes it down a little bit if you want to get more comfortable with it. But go straight in. I like to go straight in for the kilt with a bold colour, and using a lip liner rather than a lipstick.
Oh, that's how you do the lips? It's all lip liner?
All of it, and then I did use another colour over the top in Siren, but the main bulk of the colour is the liner, and also because it's more dense, it's waxy, it will stay.
Yeah, well, and the glow, just one thing I know is they have a lot of pigment. So when you get a red, you get a red, and when you get an orange, so that's one thing that's very important, is trying to get that lipstick with a pigment. You look terrific. And now, tell us what you did here. It just seems so complicated, but is it?
It's not really. It's actually just a plait and add. Just a little plait, 3 strands. To create this look, we've actually put the strands underneath.
So you tucked in, okay.
So we tucked them under, but I haven't actually brought any hair from the front, so everything has come from the back forward, and we've created the braid low down on the face, but ways that you could actually change it up, especially because we've got such beautiful long hair. But if you don't have long hair, you can always just do something in the front and work with a feature, or perhaps do something just on the side. You don't need to braid the whole hair.
Do you need a specific texture to have this kind? I mean, is it slippery, or do you need to route it up? And
I mean, day 2 is fantastic.
Is it? Like, what's it look like day 2? Can we just like mess it up and have messy hair?
If your hair's a little bit dirty, you know, it has a little bit of grit into it, it's fantastic. Otherwise, you can use things like hair potions or a dry shampoo, something like that, just to rough up the hair texture a little bit.
So you can make it a little funkier and a little messier. And
absolutely, and just by sort of getting a little bit of hairspray and just going through and just working it in like this, you can just get that really ethereal look. And then just by pulling apart the braids with your fingers, just gently, you can sort of get that really beautiful, bubbly, 3-dimensional look. And it just, again, takes it from something quite structured to something a little bit more modern and soft as well too.
So fun. So you don't have to be, you don't have to be a professional. You can do it the way you want to do it, have fun, look just like a celebrity. And I'd say we did a great job. I'm ready for the red carpet. Are you?
I am.
All right.
The Stephen Handyside Show is sponsored by BMI Healthcare, Neostrada Skincare, Nu Skin and Body Face Couture.
Aloe vera represents a significant advance in minimally invasive facial aesthetic treatments. The aloe vera treatment is a toxin-free and surgery-free approach to the immediate reduction in the appearance of dynamic wrinkles. It's unique because it uses only the body's natural response to cold to temporarily relax the muscles that cause forehead wrinkles. Aloe vera uses focused cold therapy to deliver a precise zone of cold which temporarily disrupts the nerve function, causing the forehead muscles to relax.
My name is Clint Carnell. I'm Chairman and Chief Executive Officer of MyoScience. We're a Silicon Valley-based company located in Redwood City, California. We've been developing this technology for about 9 years now. We primarily started with researchers, scientists, PhDs, and it's been a long, hard road getting here, but we're very excited to launch aloe vera, our first product, into the London, the UK market.
Well, I was introduced to the aloe vera technology a few years ago when I heard about it through various colleagues of mine from America. I was quite excited by it because I knew the amount of research and development that had gone into producing something which I feel really is at the cutting edge of aesthetic medicine. So I think there's a whole new opportunity and a whole new range of people that we could be seeing and treating with aloe vera.
Hi there, I'm Danielle Lynn and we are here with Dr. Amar Khan from the Harley Street Skin Clinic, and we're talking about pigmentation. And if this affects you, please stay with us. It's so important. And Dr. Khan, this is the first segment that we've talked about when you've been with us that I guess I didn't even know there's so much concern. Can you talk about the difference with pigmentation when you're talking about products?
Sure. I mean, the basic approach to pigmentation is very similar to anti-aging, because that will help with skin discoloration due to aging and sunlight exposure.
And what is it? Is it, now you're not talking about just brown spots. It's a whole category that
Sure. I mean, just simple brown spots are easily treated with anti-aging. However, if somebody has a real concern with pigmentation, which could be hormonal, genetic, skin type, severe damage to the skin, then they should get professional advice, because some of the products that we use are prescribed and should be monitored.
And so we were, kind of kidding around because we're in a bar and we have this cocktail shaker here. And you said there was, in reference to a cocktail, there are ingredients. So take that, but then go back to this idea of whether you should be just choosing any product. And is it safe?
Yeah, absolutely. That is a big question. The cocktail shaker will have alcohol in, which isn't necessarily good for you in excess. However, it's got fruit juices in, which have antioxidants and other very good chemicals which are good for you and they're good for your skin. So choosing the right product for you is so important, and getting professional advice will help. There are products here which are only prescribed and they can cause damage to the skin. Some of them are even harmful to the extent where they shouldn't be used in pregnancy and they shouldn't be used whilst breastfeeding.
So these are some of these are prescription, some of these are off the shelf, and I've gone into places where I've said, I want a skin lightener, you think, but you're saying be careful. That it's not like just walk into a salon and be gauged by it and say, oh yeah, you should just buy this, this, and this.
Yeah, I mean, research has shown that even the naturally occurring lightening ingredients will be converted to the more harmful ingredients in the skin for them to be effective. So just be very, very careful.
Are there ingredients in any of these that I should look for and say that looks good or there's a protection there?
I think the basic ingredients like lactic acid, alpha hydroxy acids are very good because they turn the skin over. Antioxidants and anti-inflammatories are excellent. Anything that settles inflammation.
All right, well, we're back to those antioxidants. This is really something you want to know about, and for more information, go to myfacemybody.com and find out more about the important things for your skin.
This is part of the show where you ask your burning questions to our leading experts. Now, I'm very fortunate to have here Mandy Luckman from Irwin Mitchell Solicitors. So welcome to the show.
Thank you.
Now, you've written an article in the Ultimate Beauty Guide giving consumers real advice about how to find their practitioner, because there are a lot of cowboys out there, aren't there? So it must be really important to find the right practitioner to get the right results. Is that right?
It's absolutely essential. There are some great practitioners out there providing really good services for patients, but unfortunately there's some very bad practice out there too. So we want to give advice to patients to ensure they know how to do their research properly before they decide whether to pursue a treatment option.
So what happens is, if people come to you at the point where there is no other solution, they've tried going back to their practitioner, if something does go wrong, they try and, was that right? You would advise them to try and deal with it with the doctor, and then they would come back to you and you would represent them if there was any further issues that needed to be sorted out.
Absolutely. What we do is always speak to a patient to determine what's happened to them and what they want to do to try and put things right. In many cases, we would advise them to go back to their practitioner initially, and the good practitioners do their very best to try and put things right for their patients. Unfortunately, there will be occasions where a patient has sustained quite a severe injury during the course of their treatment. For example, that may have impacted adversely on their ability to work, so they're suffering loss of earnings as a consequence of that. If that situation does arise, then we as legal experts can pursue their legal remedy for them and try and put them back in a position on a financial basis that they would have been in but for the substandard care.
So do you see, has there been a real change over the last few years where you are seeing more problems? There seems to be a lot more cosmetic clinics and practitioners doing these injectable products. Are you seeing more problems?
Unfortunately, we are, and we only see the tip of the iceberg. The industry is huge and it's expanded very, very quickly. It's the sort of thing that people now consider as part of their everyday lifestyle, and they're absolutely entitled to do that. So although there are some great practitioners there, unfortunately there have been a number of new entrants into the marketplace that have rather unscrupulous methods, and consequently more and more patients have been sustaining quite nasty injuries.
So it's good, obviously you encourage consumers to take advice from their GP through recommendations of particular cosmetic doctors they should seek. Is that right? Is that one of the first steps?
Absolutely. So to do their research is very, very important. There are a large number of independent sources of information that patients can access, including their GP, organisations such as BARPS or the BACN. It can be quite difficult, I think, to trace all independent sources of information, but they're the starting points. Okay. There's also the Department of Health-backed register of cosmetic practitioners that they can access as well if they wish to.
Great. Okay. I've just got one quick question here from Jack Fellows from Chawton. He said, has the government regulated the industry now? And I think by saying there's an independent health, but is that government regulated, or is it just an advice bureau where people can ask questions?
The register of cosmetic practitioners it's a voluntary register, so it's not compulsory for all practitioners to register on there. And I think it's very important to say that although cosmetic surgery is subject to regulation, cosmetic injectables are not subject to statutory regulation, and anybody can do them.
Great, Mandy, thank you so much for all that information. So if you are considering a treatment, obviously Mandy has said it's really important to do your research, have a proper consultation with a practitioner. And look, if you want to find out any more information, go on to myfacemybody.com and Mandy can answer any questions, and obviously pick up a free copy of the Beauty Guide, which you can download for free on the website.
The Stephen Handysides show is sponsored by BMI Healthcare, Neostrada Skincare, New Skin and Body Face Couture.